Question 1. A pharmacy technician receives a prescription for amoxicillin suspension, 250 milligrams per 5 milliliters with directions to dispense 150 milliliters and take 1 teaspoon 3 times daily for 10 days. How much amoxicillin in milligrams will the patient take per dose? A. 250 milligrams. B. 500 milligrams. C. 750 milligrams. D. 1,250 milligrams. Answer: I. 250 milligrams. This question tests your ability to interpret dosing instructions and perform simple unit conversions, a key skill for pharmacy technicians. The crucial keyword is per dose, meaning you only need to calculate the amount taken at one time. Since 1 teaspoon is equivalent to 5 milliliters and the suspension concentration is 250 milligrams per 5 milliliters, 1 teaspoonful directly translates to 250 milligrams per dose. There's no need to consider the total volume dispensed or the duration of therapy for this specific question. Remember that knowing common conversions like 1 teaspoon equals 5 milliliters is vital for accurate dosing. Question 2. Which of the following drugs is a common ACE inhibitor used to treat hypertension? A. Atorvastatin. B. Lisinopril. C. Metformin. D. Omeprazole. Answer: B. Lisinopril. This question assesses your knowledge of common cardiovascular medications and their drug classes, a frequent topic on pharmacy technician exams. The key phrase ACE inhibitor is a direct clue, and knowing that pril is a common suffix for this drug class helps identify the correct answer. Lisinopril works by blocking the angiotensin-converting enzyme, which helps relax blood vessels and lower blood pressure, making it effective for hypertension. Atorvastatin is a statin, metformin is for diabetes, and omeprazole is a proton pump inhibitor, so these are incorrect. A helpful tip is to associate common suffixes with their drug classes to quickly identify medications. Question 3. A prescriber orders a medication to be administered, QID. How many times a day should the patient take this medication? A. Once a day. B. Twice a day. C. 3 times a day. D. 4 times a day. Answer: D. 4 times a day. This question evaluates your understanding of common prescription abbreviations, which is essential for accurate medication dispensing and patient counseling. The keyword QID is a standard medical abbreviation that stands for quarter in die, meaning 4 times a day. Misinterpreting such abbreviations can lead to significant medication errors, so precise recall is crucial. For instance, BID means twice daily and TID means 3 times daily, further highlighting the importance of knowing these distinctions. Always commit these abbreviations to memory, as they are a cornerstone of pharmacy practice. Question 4. Which of the following scenarios describes a Schedule II controlled substance? A prescription for gabapentin that can be refilled 5 times. B. A medication like Adderall, which has a high potential for abuse and severe psychological or physical dependence, and requires a new prescription for each fill. C. A cough syrup containing codeine, which has a moderate potential for abuse and can be refilled up to 5 times within 6 months. D. An over-the-counter pain reliever like ibuprofen. Answer: B. A medication like Adderall, which has a high potential for abuse and severe psychological or physical dependence, and requires a new prescription for each fill. This question tests your knowledge of controlled substance schedules, a critical aspect of pharmacy law and patient safety. The defining characteristics of a Schedule II drug are a high potential for abuse, leading to severe dependence, and strict regulations, including the inability to be refilled without a new prescription. Adderall, amphetamine/dextroamphetamine, is a classic example of a Schedule II stimulant. Gabapentin is not a controlled substance in all states, though it can be in some, and codeine-containing cough syrups are typically Schedule V, not II. Understanding the precise characteristics of each schedule is paramount for compliance and preventing drug diversion. Question 5. Which of the following is a common side effect of opioid analgesics like hydrocodone? A. Diarrhea. B. Constipation. C. Insomnia. D. Hypertension. Answer B. Constipation. This question assesses your knowledge of common adverse drug reactions, a vital component of patient counseling and safety. Opioid analgesics, such as hydrocodone, are well known for their gastrointestinal side effects, with constipation being one of the most prevalent and bothersome. These medications slow down bowel movements by acting on opioid receptors in the gut, often requiring patients to use laxatives. Diarrhea, insomnia, and hypertension are not typical primary side effects of opioids. Always be prepared to educate patients about managing common side effects like constipation when dispensing opioid pain medications. Question 6. What is the maximum number of refills allowed for a Schedule IV controlled substance? I. No refills allowed. B. Up to 3 refills within 6 months. C. Up to 5 refills within 6 months. D. Up to 12 refills within 1 year. Answer C. Up to 5 refills within 6 months. This question focuses on specific regulations concerning controlled substances, an important area of pharmacy law. Schedule IV controlled substances, which have a lower potential for abuse than Schedule II or III drugs, are permitted to be refilled a maximum of 5 times within 6 months from the date the prescription was written. After this period or number of refills, whichever comes first, a new prescription is required. Understanding these refill limitations is crucial for maintaining compliance and preventing potential drug diversion. Question 7. A prescription calls for 100 milliliters of a 2% solution. How many grams of active ingredient are needed to prepare this solution? I. 0, 2 grams. B. 2 grams. C. 20 grams. D. 200 grams. Answer B. 2 grams. This question tests your ability to perform basic percentage strength calculations, a fundamental skill in compounding and dispensing. A 2% solution means there are 2 grams of active ingredient per 100 milliliters of solution. Since the prescription requires 100 milliliters of a 2% solution, you simply need 2 grams of the active ingredient. This calculation is straightforward because the volume matches the standard percentage definition. Remember that percentage strength for liquids almost always refers to grams per 100 milliliters, making these calculations manageable. Question 8. Which of the following medications is classified as an antibiotic? I. Amlodipine. B. Cephalexin. C. Prednisone. D. Citalopram. Answer B. Cephalexin. This question assesses your knowledge of common drug classes, specifically identifying antibiotics. Cephalexin is an oral cephalosporin antibiotic used to treat various bacterial infections, such as skin infections and urinary tract infections. Amlodipine is a calcium channel blocker for hypertension. Prednisone is a corticosteroid, and citalopram is an antidepressant. Recognizing the xylin, mycin, or ceph- prefixes or suffixes can often help identify antibiotics, which is a useful mnemonic for exam preparation. Question 9. According to HIPAA, which of the following is considered protected health information, PHI? I. Up to patient's name and address. B. The generic name of a medication prescribed to a patient. C. The current date. D. A pharmacy's operating hours. Answer I. Up to patient's name and address. This question tests your understanding of HIPAA, Health Insurance Portability and Accountability Act, and what constitutes protected health information, PHI, a critical aspect of patient privacy in pharmacy. PHI includes any demographic information, medical histories, test results, or insurance information that can be used to identify a patient. A patient's name and address directly identify them, making this information PHI. The generic name of a drug alone, the current date, or pharmacy operating hours do not identify a specific individual. Always remember that any information linking directly to an individual's health or identity is protected under HIPAA. Question 10. A medication order reads, Metoprolol 25 mg PO bid. What does PO indicate? I. As needed. B. By mouth. C. In the morning. D. Every other day. Answer B. By mouth. This question assesses your knowledge of common routes of administration abbreviations, which are fundamental to accurate medication dispensing. The abbreviation PO stands for per OS, which is Latin for by mouth or orally. This indicates that the medication should be taken by swallowing. Misinterpreting this abbreviation could lead to administering the medication incorrectly, potentially causing harm. Understanding these basic abbreviations is a core competency for any pharmacy technician. Question 11. What is the primary purpose of a tall man lettering system in a pharmacy? A. To organize shelves by drug manufacturer. B. To highlight expiration dates on medication labels. C. To differentiate between look-alike, sound-alike, lossy drugs to prevent medication errors. D. To indicate controlled substances. Answer C. To differentiate between look-alike, sound-alike, lossy drugs to prevent medication errors. This question tests your knowledge of patient safety initiatives in pharmacy, specifically related to medication error prevention. Tall man lettering is a strategy where parts of drug names are capitalized to emphasize differences between medications that look or sound similar, like hydroxyzine and hydralazine. Its primary goal is to reduce the risk of dispensing errors by making it visually easier to distinguish between these high-alert medications. It is not related to shelf organization, expiration dates, or controlled substance identification. Implementing such visual aids is a practical example of how pharmacies work to enhance patient safety. Question 12. Which of the following is a common drug-food interaction to be aware of when dispensing warfarin? A. Consuming grapefruit juice. B. Eating foods rich in vitamin K. C. Taking dairy products. D. Drinking alcoholic beverages in moderation. Answer B. Eating foods rich in vitamin K. This question focuses on critical drug-food interactions, which are essential for patient counseling and safety. Warfarin, an anticoagulant, blood thinner, works by interfering with vitamin K-dependent clotting factors. Therefore, consuming foods rich in vitamin K, such as leafy green vegetables, can counteract warfarin's effects and reduce its effectiveness, potentially leading to blood clots. Grapefruit juice is known to interact with statins and other drugs, but not typically warfarin in this manner. Patients taking warfarin need consistent vitamin K intake, not excessive amounts, to maintain stable INR levels. Question 13. A patient is prescribed eye drops to be administered, OU bid. What does OU mean? A. Left eye. B. Right eye. C. Both eyes. D. Each ear. Answer C. Both eyes. This question assesses your understanding of ophthalmic and otic administration abbreviations, which are distinct and crucial for correct dosing. The abbreviation OU stands for oculus uterque, a Latin term meaning both eyes. This is distinct from OD, right eye, and OS, left eye. Misinterpreting these abbreviations could lead to a patient only treating one eye instead of both, potentially resulting in an untreated condition. Always pay close attention to the specific eye abbreviations to ensure proper administration. Question 14. Which document provides detailed information about a drug's indications, contraindications, side effects, and dosing, primarily for healthcare professionals? A. Patient Package Insert, PPI. B. Medication Guide, MedGuide. C. Monograph or Package Insert. D. Consumer Medication Information, CMI. Answer C. Monograph or Package Insert. This question tests your knowledge of various drug information resources and their intended audiences. A drug monograph, also known as a package insert, is the comprehensive document approved by regulatory bodies that contains extensive scientific and clinical information about a medication intended for healthcare providers. Patient package inserts and medication guides are patient-focused documents providing simpler, critical information, while consumer medication information is a general term for patient education materials. The key here is detailed information primarily for healthcare professionals, pointing directly to the monograph. Question 15. A prescription requires 60 tablets, and the patient takes 5 tablets daily. How many days will the prescription last? A. 30 days. B. 40 days. C. 60 days. D. 90 days. Answer B. 40 days. This question evaluates your ability to perform a simple day's supply calculation, a common task in pharmacy practice. To find out how many days the prescription will last, you divide the total number of tablets dispensed by the number of tablets taken per day. In this case, 60 tablets divided by 15 tablets/day equals 40 days. This calculation ensures that patients receive the correct quantity of medication for their prescribed therapy duration. Mastering these basic math problems is essential for accurate dispensing. Question 16. What is the generic name for the brand name medication Lipitor? A. Simvastatin. B. Rosuvastatin. C. Atorvastatin. D. Pravastatin. Answer C. Atorvastatin. This question assesses your knowledge of common brand generic drug name equivalencies, particularly for high-volume medications like statins. Lipitor is one of the most widely prescribed cholesterol-lowering medications, and its generic name is atorvastatin. Simvastatin, Zocor, rosuvastatin, Crestor, and pravastatin, Pravachol are other statins but are not the generic equivalent for Lipitor. Knowing these brand generic pairs is fundamental for dispensing accuracy and patient understanding. Question 17. Which dosage form is designed to release medication slowly over an extended period? A. Immediate release tablet. B. Chewable tablet. C. Extended release capsule. D. Suppository. Answer C. Extended release capsule. This question tests your understanding of various dosage forms and their release characteristics, an important aspect of drug administration. Extended release or sustained release dosage forms are specifically designed to slowly release the active drug over a prolonged period, reducing the frequency of dosing and maintaining more consistent drug levels. Immediate release tablets dissolve quickly. Chewable tablets are for ease of administration, and suppositories are for rectal or vaginal delivery. The keyword, slowly over an extended period, directly points to the extended release formulation. Question 18. What is the correct beyond use date, BUD, for a non-aqueous compounded preparation if the original ingredients expire in 1 year and the preparation was made today? A. 6 months from today, or the earliest expiration date of any active pharmaceutical ingredient, whichever is shorter. B. 1 year from today. C. 14 days from today, refrigerated. D. 30 days from today. Answer I. 6 months from today, or the earliest expiration date of any active pharmaceutical ingredient, whichever is shorter. This question assesses your knowledge of USP compounding standards for beyond use dates, BUDs, a critical aspect of pharmacy quality assurance. For non-aqueous compounded preparations, the USP General Guideline states that the BUD should not be later than 6 months or the earliest expiration date of any component, whichever is shorter. The other options are incorrect. 14 days is for water-containing oral preparations, and 30 days is for water-containing topical/dermal and mucosal liquid/semi-solid preparations. Always prioritize patient safety by adhering strictly to these BUD guidelines for compounded medications. Question 19. A patient is allergic to penicillin. Which of the following antibiotics would be considered a potential cross-sensitivity and should generally be avoided? A. Azithromycin. B. Ciprofloxacin. C. Cephalexin. D. Doxycycline. Answer C. Cephalexin. This question tests your awareness of drug allergies and potential cross-sensitivities, which is paramount for patient safety. Penicillins and cephalosporins, like cephalexin, are both beta-lactam antibiotics and share similar chemical structures, leading to a risk of cross-reactivity for patients with a penicillin allergy. While the risk varies, it's generally prudent to avoid cephalosporins or use them with extreme caution in such cases. Azithromycin, macrolide, ciprofloxacin, fluoroquinolone, and doxycycline, tetracycline, belong to different antibiotic classes and typically do not present a cross-sensitivity risk with penicillin. Always flag penicillin allergies to ensure patient safety. Question 20. Which of the following medications requires a med guide to be dispensed with each new prescription and refill? I. Acetaminophen. B. Ibuprofen. C. Fluoxetine, an antidepressant. D. Amoxicillin. Answer C. Fluoxetine, an antidepressant. This question examines your knowledge of specific drug classes that require a medication guide, med guide, a crucial aspect of patient education and risk management. Med guides are FDA-approved patient education handouts that address issues specific to particular drugs and drug classes that pose serious public health concerns. Antidepressants like fluoxetine are one such class, due to concerns about increased suicidal thoughts and behaviors in children, adolescents, and young adults. Acetaminophen, ibuprofen, and amoxicillin do not typically require a med guide. Always ensure med guides are provided when legally required to inform patients of critical safety information. Question 21. A pharmacy technician needs to order a Schedule IV medication. Which DEA form is typically used for ordering controlled substances? I. DEA Form 106. B. DEA Form 41. C. DEA Form 222. D. Schedule IV medications do not require a special DEA form for ordering. Answer D. Schedule IV medications do not require a special DEA form for ordering. This question tests your specific knowledge of DEA forms and their application to different controlled substance schedules, an important detail in pharmacy law. While Schedule 1 and 2 controlled substances require the use of DEA Form 222 for ordering, Schedule 3, 4, and V medications can generally be ordered like other non-controlled prescription drugs, meaning a special DEA form is not typically required. DEA Form 106 is for reporting theft or loss, and DEA Form 41 is for drug destruction. Understanding these distinctions is critical for proper inventory management and regulatory compliance. Question 22. What is the term for a severe, potentially life-threatening allergic reaction that can involve widespread hives, swelling, and difficulty breathing? I. Urticaria. B. Contact dermatitis. C. Anaphylaxis. D. Angioedema. Answer C. Anaphylaxis. This question assesses your understanding of severe adverse drug reactions, particularly allergic responses, which is essential for recognizing and responding to medical emergencies. Anaphylaxis is a rapid-onset, potentially fatal allergic reaction characterized by systemic symptoms like widespread hives, urticaria, swelling, angioedema, bronchospasm, difficulty breathing, and a drop in blood pressure. While urticaria and angioedema can be part of anaphylaxis, they are not the comprehensive term for the life-threatening systemic reaction. Recognizing these symptoms quickly is critical in a pharmacy setting. Question 23. A pharmacy receives an order for insulin. What is the correct storage requirement for unopened vials of insulin? I. Room temperature, away from light. B. Refrigerated between 2 degrees Celsius and 8 degrees Celsius, 36 degrees F and 46 degrees Fahrenheit. C. Frozen at minus 20 degrees Celsius. D. In a warm, dark place. Answer B. Refrigerated between 2 degrees Celsius and 8 degrees Celsius, 36 degrees F and 46 degrees Fahrenheit. This question tests your knowledge of specific medication storage requirements, a crucial aspect of maintaining drug efficacy and patient safety. Unopened vials or pens of insulin must be stored in the refrigerator, typically between 2 degrees Celsius and 8 degrees Celsius, 36 degrees F and 46 degrees Fahrenheit, to maintain their potency until their expiration date. Once opened, most insulins can be kept at room temperature for a specific period, usually 28 days, but unopened vials require refrigeration. Improper storage can lead to degradation of the insulin, making it ineffective. Question 24. A prescription calls for Sig. 1 tab PO bid PC. What does PC mean? I. Before meals. B. After meals. C. At bedtime. D. As needed. Answer B. After meals. This question tests your understanding of common Latin abbreviations used in prescription writing, specifically regarding meal timing. The abbreviation PC stands for post-cibum, which means after meals. This instruction is important for medications that need to be taken with food to reduce stomach upset or improve absorption. In contrast, AC means before meals and HS means at bedtime. Correctly interpreting these abbreviations ensures the patient takes their medication as intended. Question 25. Which government agency is responsible for establishing the standards for compounding practices in the United States? I. Food and Drug Administration, FDA. B. Drug Enforcement Administration, D. C. United States Pharmacopoeia, USP. D. Centers for Disease Control and Prevention, CDC. Answer C. United States Pharmacopoeia, USP. This question assesses your knowledge of key regulatory and standard-setting bodies relevant to pharmacy practice. The United States Pharmacopoeia, USP, is an independent, non-governmental organization that sets public standards for the identity, strength, quality, and purity of medicines, food ingredients, and dietary supplements manufactured, distributed, and consumed worldwide, including detailed standards for compounding, g. USP less than 797. For sterile compounding, USP less than 795 for non-sterile compounding. The FDA regulates drug approval and manufacturing, the DEA handles controlled substances, and the CDC focuses on public health and disease control. Question 26. A patient asks if they can crush their extended-release ear tablet to make it easier to swallow. What is the most appropriate response? I. Yes, that is perfectly fine. It will still work the same. B. No, crushing an ER tablet can lead to a rapid release of the medication, which could be harmful. C. You can crush it, but you should mix it with a large glass of water. D. Only if you swallow it immediately after crushing. Answer B. No, crushing an ER tablet can lead to a rapid release of the medication, which could be harmful. This question addresses a common patient counseling scenario and tests your knowledge of modified release dosage forms and patient safety. Extended release tablets are designed with special coatings or matrices to release the drug slowly over time. Crushing or chewing them destroys this mechanism, leading to dose dumping where the entire dose is released at once, potentially causing toxicity or an overdose. This is a critical safety concern, and patients should be advised against it. Always educate patients on the proper administration of their medications, especially modified release forms. Question 27. What is the purpose of an auxiliary label stating "shake well before use"? I. To indicate the medication needs refrigeration. B. To remind the patient that the medication may cause drowsiness. C. To ensure that the medication's active ingredients are evenly distributed throughout the liquid. D. To prevent the medication from expiring too quickly. Answer C. To ensure that the medication's active ingredients are evenly distributed throughout the liquid. This question tests your understanding of auxiliary labels, which provide crucial patient instructions beyond the primary label. The shake well before use auxiliary label is applied to suspensions or reconstituted liquids to instruct the patient to evenly disperse the medication particles that may have settled at the bottom. This ensures that each dose contains the correct amount of active ingredient and maintains consistent efficacy. It is not related to refrigeration, drowsiness, or expiration, but solely about proper dispersion for accurate dosing. Question 28. Which of the following is an example of a potential drug-drug interaction? I. Taking a calcium supplement with a tetracycline antibiotic. B. Taking ibuprofen with food to reduce stomach upset. C. Using an inhaler as directed by the doctor. D. Storing medication in a cool, dry place. Answer I. Taking a calcium supplement with a tetracycline antibiotic. This question focuses on identifying a common drug-drug interaction, which is vital for patient safety and counseling. Taking a calcium supplement or other polyvalent cations like iron, magnesium, aluminum, simultaneously with a tetracycline antibiotic, such as doxycycline, can lead to chelation. This means the calcium binds to the antibiotic, preventing its absorption in the gut and significantly reducing its effectiveness. The other options describe appropriate medication use, storage, or drug-food interactions, which are different from drug-drug. Always screen for potential interactions when processing prescriptions. Question 29. A pharmacy technician observes a prescription for warfarin 5 mg and notices the patient's current active medication profile lists Coumadin 5 mg. What action should the technician take? I. Dispense the warfarin as written, assuming the patient has 2 separate prescriptions. B. Change the prescription to Coumadin, as it's the more common brand name. C. Verify with the pharmacist that warfarin and Coumadin are the same drug, generic versus brandy, to prevent potential duplication or confusion. D. Alert the patient that they are now taking a different medication. Answer C. Verify with the pharmacist that warfarin and Coumadin are the same drug, generic versus brandy, to prevent potential duplication or confusion. This question presents a common scenario that tests your critical thinking and awareness of brand generic equivalencies, focusing on patient safety. Warfarin is the generic name for the brand name medication Coumadin. A technician should recognize this as a potential duplication or a change in prescribing habits, and should always verify with the pharmacist to ensure the patient is not accidentally taking a double dose of the same medication or to confirm the prescriber's intent. This proactive step is crucial in preventing medication errors. Question 30. What is the appropriate temperature range for storing most refrigerated medications in Celsius? I. 0 degrees Celsius to 2 degrees Celsius. B. 2 degrees Celsius to 8 degrees Celsius. C. 8 degrees Celsius to 15 degrees Celsius. D. 15 degrees Celsius to 25 degrees Celsius. Answer B. 2 degrees Celsius to 8 degrees Celsius. This question tests your fundamental knowledge of medication storage conditions, specifically for refrigerated items, which is critical for maintaining drug stability and efficacy. The standard temperature range for refrigerated medications is typically between 2 degrees Celsius and 8 degrees Celsius, equivalent to 36 degrees Fahrenheit and 46 degrees Fahrenheit. Temperatures outside this range can lead to drug degradation or loss of potency. Understanding and maintaining these temperature controls in a pharmacy is a core aspect of quality assurance and patient safety.